All right, let's dive into a skill that is absolutely fundamental for nurses, the intramuscular injection. Now, I know it seems like a routine thing, but really mastering the evidence-based technique is so crucial for keeping our patients safe and comfortable. Let's get right into it. Okay, so first things first, let's talk about the stakes. Why does technique matter so much? Well, because when it's done poorly, the consequences can be pretty severe, and they are completely avoidable. And we're not just talking about a little extra pain here. I mean, look at this list. You're looking at the risk of permanent nerve damage, really serious infections like abscesses and cellulitis, and even injecting medication straight into a blood vessel by mistake. It's a big deal. So to make sure we're all on the same page with the best way to do this, here's what we're going to cover. We'll start with why technique is so important, then get into the nitty-gritty of picking your site and needle, walk through the actual injection step by step, touch on some common debates you'll see out there, and then wrap it all up with the key principles for safety.
All right, section 1. This is all about moving beyond that, well, this is the way we've always done it mentality, and really embracing a skilled, evidence-based approach to this everyday procedure.
And you know, this quote from Greenway really just says it all, doesn't it? These really serious complications, they aren't just unavoidable risks of the job. They are absolutely preventable. Our skill and our knowledge are what directly protect our patients from harm. Simple as that. Okay, let's move on to our prep work. Think of this next part as, getting your toolkit ready. Honestly, getting the site and the equipment right before you even walk up to the patient is half the battle for a safe and effective injection. Okay, I need everyone's full attention for this one because it is a huge deal. Let's be crystal clear. The dorsal gluteal site, yep, that upper outer quadrant of the buttock, is no longer recommended. This is one of the biggest, most important changes from older practices, and it is backed by some really solid evidence. So why the big change? Well, the risks are just too high. The dorsal gluteal muscle is dangerously close to the sciatic nerve and some major blood vessels. And on top of that, drug absorption can be slower and less reliable there, and frankly, it's just a more intrusive and uncomfortable site for the patient. So, if not there, then where? This table lays out the 4 recommended sites for us, and pay close attention to the different maximum volumes for each. You can see the deltoid is only good for small volumes, right? Up to 1 ml. For anything bigger, you're going to want to look at the vastus lateralis or rectus femoris. The key takeaway here is you've got to match the amount of drug to a site that can handle it. Now, picking the right needle is just as critical as picking the right spot. The whole point is to get that medication deep into the muscle, past any subcutaneous fat. And as you can see, the patient's weight is a really key factor. For a patient over 90 kilograms, for instance, you'll often need that longer 38 millimeter needle to make sure you actually get to the muscle. Okay, we've done our prep, we've got our site, we've got our needle. Now for the main event. Let's walk through the procedure step by step to make sure we can do this safely and smoothly every single time. Before a single thing happens, we always anchor ourselves with the 5 rights. This is your non-negotiable safety check. Right patient, right drug, right time, right dose, and right route. Think of it as your first and most important safety net. Preparation really is everything. You get consent, make sure there's privacy, do your checks and hand hygiene. But here's a pro tip I really want you to remember. Step 5. Always change the needle after you draw up the medication. The one you used to poke through the rubber stopper, it's dull now. Using a fresh, sharp needle for the actual injection makes a huge difference in reducing pain for the patient. And when it's time to inject, what's our angle? It's a straight-in, 90-degree angle to the skin. No question. This makes sure you're getting that medication deep into the muscle tissue, right where it needs to be for an IM injection. Okay, let's do this. After prepping the skin, you stretch it taut and insert the needle with a quick dart-like motion. Now here's where the technique gets really interesting, steps 4 and 5. You have to inject slowly. We're talking about 1 ml every 10 seconds. This gives the muscle time to accommodate the fluid, which really cuts down on the pain. And then you wait for a full 10 seconds. That pause is what lets the drug start to disperse and, crucially, keeps it from leaking back out. Now, for medications that are known to be irritating, the Z-Track technique is absolutely best practice. It's such a simple but brilliant method. You just pull the skin and the tissue underneath over to one side before you insert the needle. Then you inject, wait, pull the needle out, and then you let go of the skin. It creates this zigzag path that basically seals the medication deep inside the muscle. No leakage, no irritation, it's awesome. And we're not done just because the needle's out. First thing, get that sharp into the sharp spin immediately, safety first. Then, after making sure your patient is comfortable, you have to document everything. And please, don't just write IM injection. You have to document the specific site you used. This is so important for site rotation and preventing tissue damage down the line. Okay, let's talk about some of those gray areas. In this section, we're going to tackle a few things where you might see different nurses doing different things. Knowing the why behind these debates really empowers you to think critically about your own practice. And here it is, probably the #1 debate you'll hear when it comes to IM injections. Should you pull back on that plunger after the needle is in to check for blood? To aspirate or not to aspirate? That is the question. And what you see here is exactly why it's a debate. The guidance is literally conflicting. You've got the UK Health Security Agency saying it's not necessary for vaccines in the recommended sites because there are no major blood vessels there, but then other expert sources still recommend it as a safety check. So yeah, you're going to see different approaches. So what's the bottom line on aspiration? Or on skin prep? Or even whether or not to wear gloves? It's this. When the evidence is conflicting, your local policy is your guide and your final authority. You absolutely have to know and follow your facility's protocols. All right, let's bring it all home. This last section is all about boiling it down to the absolute must-knows so you can walk away from this feeling totally confident in doing this skill safely and effectively. Look, if you remember nothing else, please remember these 5 principles. This is your foundation for safety. Always start with the 5 rights. Always avoid the dorsogluteal site. Always use the right needle. Use Z-Track when you need to. And please, please, always document the specific site you used. And finally, let's never forget the patient's experience. You know, safe practice is also compassionate practice. We can make this so much better for them just by making sure the muscle is relaxed, using that smooth and quick needle motion, injecting slowly, and of course, rotating sites. Our technique and their comfort, they really go hand in hand. So, I'm going to leave you with this question to take back with you. Now that you're armed with the latest evidence, what's one outdated ritual, maybe it's still seeing the dorsal gluteal site used, or maybe people aren't changing the needle, that you can help change? You can be that nurse, the one who champions best practice on your unit. Thanks so much for joining me.